Welcome to Module 5 of the 6-module training program for community partners. This is the second part of the 3-part training on how to assist individuals to apply for healthcare coverage in the Washington Healthplanfinder web portal at www.wahealthplanfinder.org. In this module, we will cover the following topics: application process for Apple Health, Medicaid plan selection, and the change reporting and renewal process. Let's begin with an overview of eligibility for free and low-cost coverage in Healthplanfinder. This chart compares the programs associated with free and low-cost insurance, including Apple Health Medicaid and Health Insurance Premium Tax Credits, or HIPTC, with qualified health plans, frequently referred to as QHP. The primary differentiator between these programs is the level of income. Here is a list of modified adjusted gross income or MAGI-based programs that an individual or family applying for Washington Apple Health in Healthplanfinder may be eligible for. Apple Health for adults, families, kids, with premiums for kids, pregnant women, and the Apple Health Alien Emergency Medical Program, also known as AEM. Also shown is the Qualified Health Plan with Tax Credits, often referred to as QHP with Tax Credits, or HIPTC. The federal poverty levels, or FPLs, indicated on this chart share some of the current limits associated with various Apple Health programs. To qualify for Washington Apple Health for adults, your income must fall below 138% of the FPL. Apple Health for pregnant women is for those with income up to 198% of the FPL. Apple Health for kids covers children whose families are at an income up to 215% FPL. Apple Health for kids with premiums is a program that covers children in families with income above 215% up to 317% of the FPL and requires paying a low-cost monthly premium. QHP with tax credits, often referred to as Health Insurance Premium Tax Credits or HIPTC, is available to adults and families with income above the Apple Health Medicaid standard up to 400% of the federal poverty level. This program is managed by the Health Benefit Exchange. HIPTC is an additional way to help lower the costs of coverage for families seeking insurance through Healthplanfinder. HIPTC are tax credits put towards the purchase of a QHP or qualified health plan. Let's get started by reviewing the application for free and low-cost coverage in Healthplanfinder. An individual or family that qualifies for Washington Apple Health programs will create an account or may choose to continue as a guest if applying for Apple Health, as you already covered in Module 4 during the individual account creation lesson. Individuals enter their information in Healthplanfinder, which will determine their eligibility for the various programs. This screen describes Healthplanfinder's interface with external services, the Federal Hub, and the Eligibility Service. The Federal Hub verifies behind the scenes income and citizenship immigration status and interfaces with the Social Security Administration, the IRS, and Employment Security. The Eligibility Service, using information verified by the Federal Hub, returns individual eligibility results for each household member. Once determined eligible, the information provided on the application is sent to Provider 1, which is another system external to Healthplanfinder, where healthcare coverage is finalized. Enrollment into a managed care plan can be completed by the user in Healthplanfinder once eligibility for Apple Health has been approved. If the user chooses to skip plan selection, they will be auto-enrolled into a managed care plan overnight. We'll talk more about Medicaid plan selection later in this module. After the primary applicant completes the About You screen, the Social Security number provided will be sent to the Federal Hub for verification. The Federal Hub will then send a response back to Healthplanfinder as either SSN verified or SSN not verified. It will also check for citizenship status and incarceration status linked to applicants. This information is stored in the Washington Healthplanfinder system and is not visible to consumers. The information will be later used when determining eligibility for coverage. The Federal Hub is called after the application review screen to verify that information provided by the applicant about lawful presence, income, and non-employer-sponsored insurance minimum essential coverage is accurate. After the applicant has clicked Next on the application review screen, Washington Healthplanfinder will make an additional call to the Federal Hub. The call will verify MEC status, or minimum essential coverage, checking to make sure the applicant is not already enrolled in one of the following non-employer-sponsored insurance minimum essential coverage programs. These include Medicare, TRICARE, Peace Corps, or the Veterans Health Program. If the applicant is already receiving coverage through one of these programs, they will not be eligible for free and low-cost health insurance programs on Washington Healthplanfinder, but could still apply for a qualified health plan. If the applicant has passed ID proofing, then income will also be verified during this call. If they fail ID proofing, the Federal Hub will not verify income. If the applicant's citizenship status was not verified by the first Federal Hub call, the applicant is allowed to enter lawful presence information, or if the applicant has attested to being lawfully present, then their lawful presence status will be verified by this call as well. On the About You screen, the primary applicant will provide information only about himself or herself, such as name, social security number, date of birth, and gender. Next, the primary applicant will select who he or she is applying for: myself, myself and others, or other household members. To apply for Washington Apple Health, the individual must answer yes to the question, do you want to apply for premium health insurance tax credits, cost-sharing reductions, or Washington Apple Health? If they answer no, they will not be considered for any of these programs and will only be able to purchase a full-cost qualified health plan without health insurance premium tax credits. This section of the screen allows the individual to indicate whether or not they are an American Indian or Alaska Native. This screen also allows the applicant to complete race and ethnicity items as well as read and attest to the Washington Healthplanfinder privacy policy. The system will next ask the primary applicant to provide a series of contact information from addresses to phone numbers as well as language preferences. The address provided here will later be used to verify Washington State residency, which is an eligibility requirement for coverage on Healthplanfinder. The system will next ask the primary applicant to confirm your identity and answer a number of questions that are attached to the primary applicant's person ID. The system will next ask the primary applicant to provide information on their tax filing status for either the current year and last year, or the current year, last year, and next year, depending on the time frame when the individual is applying. The system will next ask the primary applicant to identify whether or not they have any other household members or tax dependents. Each additional individual will need to be added through the Add Person button on the left-hand side of the screen. Next, the primary applicant will answer a series of additional questions to indicate citizenship status, incarceration status, tobacco use, which does not affect eligibility for Apple Health, current health insurance status, and Washington residency. Information provided here will be validated against the Social Security number provided earlier. Next, the primary applicant will answer a series of additional screening questions to indicate long-term care coverage or unpaid medical expenses coverage, also referred to as retroactive coverage. Next, the primary applicant will answer a series of questions around their household income, such as which household members are employed, is the primary applicant a public employee, is anyone in the household self-employed, does anyone in the household receive dividend payments, or does anyone receive income in the form of rent or royalties. Next, the primary applicant will answer a series of questions around their household income, specifically deductions, such as, are you paying tuition for a student in your household? Does anyone contribute to a health savings account? Does anyone have expenses related to alimony or spousal support? Next, the primary applicant will answer a series of household income question details: net monthly amount, employer name, and employer address. On this page, the primary applicant reviews all the data they have provided over the course of the application process to ensure its accuracy. The primary applicant can edit any incorrect information from this page. In an effort to reduce basic system error codes, the following 6 system rules will be run before the information goes to the eligibility service. Monthly income and monthly deductions must both be less than $9,999,999. Household member's date of entry to the U.S. cannot be before date of birth or in the future. If a household member has identified as a non-U.S. citizen, they must answer the lawful presence question. At least one household member must be identified as seeking coverage. Relationships between household members must be provided and must match. And lastly, the correct tax filing status must be made for each household member. Once the primary applicant has completed all the application data collection screens, he or she can review their application in its entirety. If the applicant is comfortable with all responses provided, he or she will e-sign the application and submit. After submitting the application, Healthplanfinder will run a variety of validations in the back end and will then display eligibility results to the applicant. After the application data has been collected, Healthplanfinder calls the eligibility service to determine the eligibility of all household members listed on the application. Eligibility factors that must be verified include Social Security number, citizenship, and immigration status. The Federal Hub is one verification source of all these factors. Washington Apple Health coverage is generally approved for a 12-month certification period. The renewal period starts with the first month coverage is approved, typically the application month. Apple Health coverage does not have an open enrollment period. You can apply, be approved, and enroll at any time throughout the year. Washington Apple Health requires individuals age 19 or older to apply for their own coverage when otherwise eligible for Apple Health. This means young adults transitioning to Apple Health for Adults coverage must submit their own application. When users age out of their coverage in Healthplanfinder, they receive a correspondence alerting them that their coverage will be ending soon and that they will need to reapply to redetermine their eligibility. Though the correspondence will be generated by the Healthplanfinder system, this transition of coverage is not automatically performed by Healthplanfinder and will require action on behalf of the user. In order for a pending eligibility status to become approved, the applicant must provide verification documentation within 90 days proving that the information they attested to is accurate. During that 90-day period, they will receive coverage. If they do not provide documentation within that window, their coverage will be revoked. Children and pregnant women qualify for Apple Health coverage regardless of their immigration status. This page is the eligibility status page, where the applicant will view the eligibility results for every person requesting coverage on this application. There is an individual tab for each household member located in the left navigation bar. This page provides a high-level summary of the coverage each household member listed on the application will be receiving. By clicking Next, the primary applicant is taken to their individual dashboard. There are times when an individual will be referred to DSHS's Washington Connection application portal. A referral occurs when someone listed on an application for health coverage through Healthplanfinder may be eligible for services not provided through Healthplanfinder, such as food, cash, or child care assistance. A referral may also occur when an individual may be eligible for Apple Health Care coverage not offered through the Healthplanfinder, which includes long-term care support or coverage for individuals who are aged, blind, or have a disability. Those who qualify for Medicare or who require additional services may be eligible for other Medicaid programs and would complete additional data collection in Washington Connection. There are 3 possible locations for the early screen out pop-up. This screen shows an example of the early screen out pop-up that appears after pressing Next on one of these three locations: the About You screen, after the About Your Household page, and after the Additional Questionnaire page. At this point, the applicant has the option to continue in Washington Healthplanfinder or to transfer the information they've entered thus far to Washington Connection. Even if they chose to continue in Washington Healthplanfinder at this point, they may still see a referral after viewing their eligibility results. This is the referral page the user would view after eligibility results have been displayed. The user has the option to transfer the information entered on this application to Washington Connection. We will now cover Medicaid plan selection, implemented in May of 2015. Medicaid plan selection is the process of selecting a managed care plan once an individual is determined eligible for Apple Health coverage. There are two parts to gaining coverage in Apple Health. Part 1 is determining eligibility for Apple Health coverage that we just covered in Lesson 4. Individuals must complete the application process in Healthplanfinder to determine their eligibility for coverage. Part 2 is completing enrollment in a managed care plan. Once an individual is determined eligible for Apple Health coverage, the system will determine whether they can enroll in a managed care plan. This is called Medicaid plan selection. In the last section, we left off on the household summary screen, which before Medicaid plan selection would be the final step in Healthplanfinder for Apple Health recipients. With Medicaid plan selection, the Apple Health individual has the option to select a managed care plan that best fits their needs based on plans available in their area. The Apple Health individual can take two enrollment paths: select a managed care plan or skip plan selection. Let's dive into option 1, selecting a managed care plan. Clicking Continue on the household summary will navigate the individual to their Explore Your Options screen to select a managed care plan. We'll refer often to the Explore Your Options screen as the EYO screen in today's presentation. On the EYO screen, they will see which managed care plans are available to them. The managed care plans that the individual is eligible for will be returned by Provider 1 and displayed on the page. Under My Search, an individual can see all individuals who are eligible to select a plan, search by provider, and search by clinic hospital. An individual can use Customize My Search to filter by managed care plan. Each managed care plan offers additional information. By clicking More Information on this plan, they will be able to view benefit information. Benefit information will essentially be the same for all Apple Health managed care plans. After browsing, the individual will click Select on the managed care plan of their choice. The individual will be navigated to the Household Summary page, where they will see that their enrollment has been approved by the Healthcare Authority and returned to Healthplanfinder by Provider 1. Once clicking Next, they will be navigated to their individual dashboard, where all enrollments, coverage, and managed care plans will be displayed. Please note that Apple Health for Kids with premiums, also referred to as CHIP premiums, cannot be paid through Healthplanfinder, and payments will not be displayed on the Household Summary page. Households eligible for Apple Health for Kids with premiums will receive a monthly invoice from the Office of Financial Recovery. The individual will see their enrollment and plan selection is finished. For new individuals, the coverage start date rules go as follows. The individual will be covered by Apple Health starting the first of the month of application. The red arrow demonstrates that this example individual applied on December 4th, so he is covered starting on December 1st. The newly selected Apple Health Managed Care Plan will start the first of the month following plan selection, if selected by the second to last business day of the month. For example, if they select a plan on December 20th, they will be covered with that new plan beginning on January 1st. If they select their plan after the second to last business day of the month, they will be covered by their new plan starting the first of the next following month. For example, if they select a plan on December 31st, their new plan will begin on February 1st, but their Apple Health coverage will begin on December 1st. Let's move on to option 2, skip plan selection. The individual has the opportunity to opt out of plan selection by clicking Skip Plan Selection on their EYO page. If the individual skips plan selection, they will be auto-enrolled by Provider 1. The individual will be navigated directly to their individual dashboard, where they can see their Apple Health coverage. This is what their dashboard will look like right after opting out of plan selection. The individual is able to select a managed care plan by clicking on the Enrolled link. When the individual is enrolled in a managed care plan overnight in Provider 1, their managed care plan will be displayed in Healthplanfinder. The 3 scenarios we'll cover to better understand the Medicaid plan selection experience for new applicants includes 1. Apple Health only household with no American Indian, Alaska Native members, also referred to as AIAN throughout today's presentation. 2. A mixed household, QHP and Apple Health coverage. And 3. American Indian, Alaska Native, Apple Health individuals and households. First, we will cover an Apple Health only household, none of whose members are AIAN. The primary applicant will see the current enrollments for each individual within their Apple Health household on the Household Summary modal. They will be prompted to click Continue to move forward with processing their application. If the primary applicant is new to Apple Health and Healthplanfinder and they are not seeking coverage, the household will not be able to continue with plan selection and will be navigated back to their dashboard. They will still be covered under Apple Health and will be automatically enrolled in a managed care plan at a later date as determined by the healthcare authority. However, if the family has had Apple Health coverage in the past, they will be able to proceed with plan selection even if the primary applicant is not seeking coverage. Provider 1 will return common managed care plans for the entire household, meaning the managed care plans available that every member of the household is eligible for. They will be able to customize their search by the managed care plan. The primary applicant may choose only one managed care plan to cover the entire household. Even if the Apple Health only household members are on different Apple Health programs, such as children are eligible for Apple Health for kids and the mother is eligible for Apple Health for pregnant women, their EYO page will only display the common managed care plans which apply to all members of the household, and one managed care plan will still need to be selected. After they select the managed care plan for their household, the primary applicant will navigate through the rest of the application and end up on their dashboard where they will see all enrollments for their household as previously discussed. The provider search functionality is for those found eligible for Apple Health coverage who are looking for a managed care plan. An individual can search and select a new managed care plan within Healthplanfinder by using the provider search to see which, if any of their preferred doctors, are covered by which plan. Each Apple Health eligible household member can select up to one preferred healthcare provider and one preferred clinic hospital. Healthplanfinder can then be filtered to display plans which accept those providers. Individuals can search for specialists in addition to primary physicians, but they can only select one provider per household member. Selecting a provider or clinic hospital is optional. Over the next few slides, we'll discuss how to search for and add healthcare providers and clinic hospitals for each household member. We'll also review how those provider preferences can be used to filter managed care plans accordingly. Apple Health individuals can search for healthcare providers using these search criteria. The individual must select at least one criteria to search with, other than distance in miles. In this example, the individual is choosing to search by zip code and distance. On this page, individuals can also add a provider's first and/or last name if they are searching for a specific person. Based on the search criteria provided, Healthplanfinder will return the results that meet that criteria. The individual can then find more information on each provider by clicking on the provider's name or by clicking Get More Information. The provider directory will be updated periodically, with the schedule still to be determined. The provider search will only find providers that are in network with at least one managed care plan. As a result, tribal clinics and their providers will not appear in search results unless they are in network with a managed care plan, such as a doctor practicing at both a tribal clinic and a hospital. Individuals can view more information about each healthcare provider before making a formal selection. Once an individual reviews their provider search results, they can select a specific healthcare provider for each family member. Note that while you can select different providers for each individual Apple Health eligible family member, only one managed care plan must be selected for all Apple Health eligible family members. Similar to adding a healthcare provider, the individual will click Add underneath Search by Clinic Hospital to search for and select a clinic hospital for each household member. While you can select different clinic hospital for each individual Apple Health eligible family member, only one managed care plan must be selected for all Apple Health eligible family members. The healthcare clinic hospital search functionality is only available for those going through Medicaid plan selection. The healthcare clinic hospital search option is not available for those shopping for a qualified health plan. Apple Health individuals can search for healthcare clinics, hospitals using these search criteria. The individual must select at least one criteria to search with other than distance in miles. In this example, the individual is choosing to search by zip code and distance. The search will display any results that contain the text the individual entered. For example, if an individual enters ME in the search bar, their results could include Army Medical Center and Mercy Hospital. Based on the search criteria provided, Healthplanfinder will return the results that meet that criteria. The individual can then find more information on each clinic hospital by clicking Get More Information or by clicking on the clinic hospital's name. Once an individual reviews their clinic hospital search results, they can select a specific clinic hospital for each family member. The provider directory will be updated periodically, with the schedule to be determined. The clinic hospital search will only find clinic hospitals that are in network with at least one managed care plan. As a result, tribal clinics and their providers will not appear in the search results unless they are in network with a managed care plan, such as a doctor practicing at both a tribal clinic and a hospital. This table lists tips for data validation when searching for a provider or clinic hospital. The data validation message column lists the error that may be seen. The tips column shares why the message may have been received. Next, we'll review a mixed Apple Health and qualified health plan household, none of whose members are AIAN. The primary applicant will see the current enrollments for their entire household on the household summary modal, including QHP with or without tax credits and Apple Health. They will be prompted to click Continue to move forward with processing their application. The primary applicant will be navigated to the EYO page for the Apple Health eligible members of their household. All Apple Health eligible household members will be listed under Looking for a Plan to Cover. They will be able to customize their search by managed care plan. If there are multiple members in this household that are Apple Health eligible, this will follow the same business rules as the Apple Health only household. Provider 1 will return common managed care plans that the primary applicant can select for the household, which will apply to every Apple Health eligible member of the household. Any members of the household who are not covered by Apple Health will be indicated by the Does Not Cover section. After the primary applicant has selected a managed care plan for the Apple Health eligible members of the household, they will then be navigated to the EYO page for any QHP eligible members of the household. There, they will select and purchase a qualified health plan for those eligible household members before moving on to finalize all selections within the household. Only in a mixed Apple Health household will the primary applicant view the final confirmation page after selecting their QHP coverage. The final confirmation page will display the selected plans for only the QHP individuals in the household. Lastly, let's review an AIAN Apple Health individual and household scenario. Like any other household application, the household summary modal will display the enrollments of each individual in Apple Health. When they click Continue, they will be navigated to the EYO page for AIAN. If this is a mixed household with AIAN Apple Health and non-AIAN Apple Health members, the household will first be directed to the non-AIAN Apple Health Explore Your Options page, and then the AIAN Apple Health Explore Your Options page. The EYO page will display managed care plans available to the AIAN Apple Health individual or household members. For an AIAN Apple Health household, they must select a common managed care plan for all AIAN Apple Health members of that household who chose to enroll in a managed care plan. For mixed households, with both Apple Health non-AIAN and Apple Health AIAN members, the individual will first be directed to the Apple Health Explore Your Options page to select a managed care plan for those non-AIAN household members, and next to the Apple Health AIAN Explore Your Options page. Coverage without a managed care plan is a plan type returned by Provider 1 as an option only for AIAN individuals. If the individual chooses that option, they will not be enrolled in a managed care plan and will be enrolled in coverage without a managed care plan. The individual is still covered by Apple Health. The AIAN individual household may customize their plan search by managed care plan or plan type. This is unique to the AIAN individual, as typical Apple Health individuals can only search by managed care plan. The two plan types the AIAN individual may search for are No Managed Care Plan and Managed Care Plan. For AIAN Apple Health households, the primary applicant has the option to choose one managed care plan for the Apple Health AIAN individuals in the household, or choose coverage without a managed care plan for the AIAN members of the household that do not want to select a managed care plan. They cannot make individual plan choices for each AIAN member of the household who want to select an Apple Health managed care plan. In terms of the process flow, after this EYO screen, if there are QHP eligible members of the household, they will be directed to the QHP shopping experience. In the three scenarios reviewed, the primary applicant may decide to skip plan selection for the Apple Health individuals in their household on the EYO page. The family will be covered without a managed care plan. In a mixed household, Healthcare Authority may elect to enroll the non-AIAN Apple Health eligible family members in an available managed care plan at any time. This will not occur for the AIAN Apple Health eligible family members. At any point, the primary applicant may log into Healthplanfinder and select a plan for the Apple Health individuals in their household. This is what the individual dashboard on the Account Home tab looks like for an Apple Health individual or household. It will contain information and links to pull further information on the enrollment status and plan selected for each of the household members. The individual may click on the Enrolled link to navigate to the Apple Health Enrollment Details modal to retrieve more information on their specific managed care plan. If the individual clicks on the Enrolled link under Enrolled Status on the dashboard, this modal will appear with the following information: individual covered, managed care plan name, managed care plan start date, and managed care plan end date. This modal will always share this information listed on one line. From this modal, the individual can choose to change plans. The My Household coverage on the individual dashboard will contain the following information for each individual: individual covered, plan name, start date, end date, renewal date, and enrolled status. From this section, the individual can click on the Washington Apple Health hyperlink listed for each member of the household for more information on their selected managed care plan. A modal will pop up for each individual containing more information on the enrollment details and managed care plan selected of each individual. We will now cover several of the plan selection prompts and modals which the individual may experience prior to or after the plan selection process. Note that this is not a comprehensive list of all possible prompts and modals the customers may experience, just examples of some of the few potential common ones. We have grouped the important messaging to know about into two groups. system prompts and modals before plan selection, and system prompts and modals after plan selection. For more information on how to manage additional modals and prompts, please refer to the Healthplanfinder Operator's Manual. This modal will return additional information to the individual after clicking Washington Apple Health on their dashboard, including enrollment and eligibility information. The individual can view coverage through Apple Health under their eligibility status, plan name and plan type, and coverage start and end dates. Let's review the system prompts or modals that may be seen before plan selection when no plan selection is available. After the eligibility status screen, one or more individuals in the household may not be allowed to move on to plan selection from the household summary modal, but they will be covered without a managed care plan. If this occurs, the individuals will not be able to move forward with plan selection and will be navigated to the Managed Care Plan Selection Details modal, which we'll review on the next slide. Some of the instances which will cause the individual not to be able to move forward with plan selection include if Healthplanfinder and Provider 1 are unable to interface, if Provider 1 does not pull any plans for the zip code provided, if the individual's Medicaid ACE's client ID number is not recognized by Provider 1, if there are any data validation errors, or other technical issues. If the primary applicant is new to Apple Health and Healthplanfinder and the individual is not seeking coverage, the household will not be able to continue with plan selection. They will be enrolled in Apple Health and will be automatically enrolled in a managed care plan at a later date, as determined by Healthcare Authority. However, if the family already has previous information, such as an account within Healthplanfinder or a Medicaid ACE's client ID number, they will be able to proceed with plan selection even if the primary applicant is not seeking coverage. The Apple Health Managed Care Plan Selection Details provides further information on who within the household can move forward with plan selection and who cannot. By clicking Continue, the primary applicant will be navigated to plan selection for those eligible individuals in the household. For those members identified as having no managed care plan available, here is an example of the modal which will list the reason why the Apple Health member could not select a plan. By clicking Continue from this modal, the primary applicant will be taken back to their dashboard where the individual will see that they have Apple Health coverage without a managed care plan. For individuals who are not eligible to select a plan, they will receive information from Provider 1 about their auto-enrollment. Now let's review system prompts and modals after plan selection and possible enrollment statuses. Once the individual selects a plan for their household, they will be navigated to their household summary page, where Provider 1 will have returned one of the three following enrollment statuses: approved, pending, or rejected. In this screenshot, the household has received all different enrollment statuses for individuals within the household. If the individual's selected plan is approved, the individual will be enrolled by Provider 1 overnight and no further action is needed. On the next slides, we will go into detail regarding pending and rejected enrollments. If the individual's selected managed care plan is pending, it will require manual review by Healthcare Authority staff. The individual may or may not be enrolled into their selected managed care plan. Healthplanfinder will display the reason behind this pending enrollment and clarify next steps when the individual clicks Next to be taken to their dashboard. If the individual's selected managed care plan is rejected, it will require manual review by Healthcare Authority staff. The individual will not be enrolled into the selected managed care plan. Healthplanfinder will display the reasoning behind this rejected enrollment and clarify next steps when the individual clicks Next to be taken to their dashboard. The process for reporting a change or submitting a manual renewal in Healthplanfinder has not changed. Let's review how to process Medicaid plan selection after completing one of these two processes. Apple Health individuals can change their Apple Health managed care plan at any time. For Apple Health individuals, there is no cutoff when changes can be reported as long as Apple Health eligibility is approved. Some examples of changes that must be reported are birth, death, or divorce resulting in adding or removing household members, address change, income change, loss of minimum essential coverage, and pregnancy or a change in pregnancy status. To report a change on Healthplanfinder, the individual will go through the same change reporting process that they do today. There are no changes to the change reporting link and screens in Healthplanfinder, starting from report a change in income or household through the primary applicant's signature page. After the change is submitted, the plan selection process and screens that the individual will encounter are the same as those we reviewed previously today. To report a change, on the Account Home tab, click on Report a Change in Income or Household. Here is the screen to report changes or a life event. Select the reason for the change, click Next. Reminder, it is not necessary to select No for the reasons not used. The only time you may want to select No is if you have inadvertently selected Yes to a reason and you want to cancel out the yes. This confirmation modal is displayed when the applicant has requested to be evaluated for free or low-cost coverage. Confirm the change by clicking Next. This confirmation modal is displayed when the applicant has reported changes for information that were not previously provided. Confirm the change again by clicking Next. This Add Household Member pop-up is displayed when the applicant wants to add a household member. Be sure to scroll down to answer all questions asked, and enter any required information and click Save. This Remove Household Member pop-up is displayed when the applicant wants to remove a household member. Click the drop-down list and select the reason for removal, and click Next. When the primary applicant reports a change to remove a household member, the household member will be tagged in Healthplanfinder with Removed, but will not physically be removed until the application is resubmitted and eligibility determination is complete. Because the household member remains on the application through the eligibility redetermination process, there is a reduced likelihood that the applicant will experience eligibility service errors during the change reporting process for removal of a household member. There is no change to the Apple Health renewal process in Healthplanfinder. First, let's take a look at auto renewals. Around the 60th day before the certification end date, an attempt to auto-renew Apple Health coverage is completed. Healthplanfinder sends the individual's information to the eligibility service, which makes a determination as to whether the applicant is under the Medicaid income standard and remains eligible for Apple Health. If they are still eligible for Apple Health, they are renewed and sent the Apple Health renewal notification displayed on the screen. They will continue with their current managed care plan. If that plan is unavailable, they will be auto-enrolled by Provider 1 and receive a notification. Remember, even if they are auto-renewed, individuals always have the option to change their managed care plan. Now let's review when an individual must complete a manual renewal in Healthplanfinder. After manually renewing and being found eligible for Apple Health coverage, the individual now has the option to select an Apple Health managed care plan rather than be auto-enrolled into the default plan. If the individual is no longer eligible for Apple Health after manual renewal is completed, they will be given the option to shop for a qualified health plan with or without tax credits. To review, the process works like this. The individual reports their change in Healthplanfinder or completes their manual renewal in Healthplanfinder. The application is submitted with changes, and if the household is determined still eligible for Apple Health, the individual will have the following three options. 1. Skip plan selection and be auto-enrolled in a managed care plan. 2. Continue with their existing plan if the plan is still available. Or 3. Select a new managed care plan. If the individual is no longer eligible for Apple Health, they will be directed to shop for a qualified health plan. As with the Apple Health initial enrollment process, individuals may choose to skip plan selection. To skip plan selection, the individual will log out, closing Healthplanfinder and ending the session, or click the Skip Plan Selection button at the bottom right of the EYO screen. If an individual skips plan selection, Provider 1 will enroll Apple Health eligible household members in a plan overnight. Also, if an individual skips plan selection and the same plan they were enrolled in is still available, they will remain enrolled in that plan. If the same plan is no longer available, a new managed care plan will be assigned overnight. Members who have been added and had no previous enrollment are automatically enrolled in the same plan that the other household members were enrolled in before the change report or renewal was submitted. If the individual's current Apple Health plan is still available, the individual can continue with the current plan by selecting the plan that the household is currently enrolled in. The individual's current plan, if still available, will be highlighted at the top of the EYO screen. If all members under Looking for Plan to Cover are eligible for the common current plan and it's available, it will be displayed and highlighted. For new and existing Apple Health households, individuals who select a plan will be enrolled by Provider 1 overnight. To select a new managed care plan after change reporting or completing a renewal, on the EYO screen the individual would select a new plan for the household to be enrolled in Provider 1 overnight. When it comes to change reporting for Apple Health, there is a key date that we want to introduce to you all, the Managed Care Enrollment Cutoff Date. An important thing to remember is that these dates are determined by Healthcare Authority and the information is returned through the interface with Provider 1. The enrollment cutoff date is the day before the last business day of the month. If the change is submitted on or prior to the enrollment cutoff date, the individual's enrollment in a managed care plan starts on the first of the next month. If the change is submitted after this date, the Apple Health Managed Care Plan will start on the first of the month following the next. The individual's current coverage will continue until the next coverage begins. For example, that means if a QHP individual reports a change on May 15th that makes her eligible for Apple Health, her enrollment in the new Apple Health plan will start on June 1st. She'll be duly enrolled in her QHP plan and Apple Health coverage without a managed care plan through the end of the current month. To change plans without going through the change reporting process, or if an individual changes his or her mind after selecting a plan during change reporting, they can click on Enrolled on their dashboard to view the enrollment details modal. On this modal, the individual can change plans by simply clicking Change Plans. This will direct them to the EYO screen to select a new plan. The enrollment cutoff date that we reviewed earlier also applies to the managed care plan start date. So if the plan change is made on or before the enrollment cutoff date, the new plan will start the first of the next month. If the plan change is made after the enrollment cutoff date, the new plan start date will be the first of the month following the next month. Please remember that the current plan will continue until the new plan begins. Congratulations! You have completed Module 5 of the Healthcare Authority Community-Based Training. Please continue on to Module 6 of the 6-module HCA Community-Based Training.